You're sometimes exhausted at the end of the day, but again, it's all worth it. Every single bit of it's worth it, coming to work every day.
Step by step, COVID-19 patients gain their strength back. They take each step, do each task, right alongside a dedicated healthcare provider.
When the patients come here, they're very weak, they feel defeated, and it's tough for them, and we have to be the light in this dark situation for them. So we just give them the best care. We assure them that we're going to do everything in our power to get them stronger.
They're working me hard, all I know they is.
But 67-year-old Barrett Davis isn't complaining.
The nightmare is over with.
Just a few weeks ago,
I had to say, Lord, take me, because I was suffering.
Near death, Barrett survived and is now at Encompass Health. He was able to leave the hospital, but couldn't go home.
When they come into our facility, they are quite weak and debilitated. The muscles atrophy. They're unable to stand up, move their limbs. They can't take care of their functional tasks, such as ADLs or activities of daily living, more in the morning, dressing, bathing, hygiene, sitting up and eating.
But let's back up. Early on, as hospitals began to see COVID-19 patients, those that survived couldn't stay in the hospital, and they couldn't find another place to go.
So how many rooms we have available for isolation rooms?
Encompass Health, a rehab hospital in Petersburg, decided to open their doors.
Do not fear the COVID. Rehab is here to help out. We'll get patients home.
But of course, staff had concerns.
I had very mixed feelings about it.
I was initially worried because we would be putting ourselves at risk caring for COVID-19 patients.
But the concerns were short-lived.
I knew we had a duty to take these patients in, and it was a great need.
And so the patients came from across Central Virginia.
As a nurse, our team has probably in their career, this is one of the hardest times for them.
And the staff took the same precautions as with any other patient.
It's an everyday task to us, how we practice in here, other than using PPEs and appropriate masks. It's the same task at hand here.
With the same goal for any patient in the building.
Every single COVID patient that we've brought into our facility has been successfully rehabilitated and returned home. So our staff is happy to come into work.
To see such positive experiences and everyone being discharged home to their families, it's been amazing.
And for patients like Barrett, who thought he would die in the hospital,
amazing grace, ain't it?
People that thought that they may never walk out of the building or go home or recover from this, we're helping them get back to their homes.
When a COVID-19 patient is discharged, it's cause for celebration.
When we see them go home, that's the emotion on the other end of the spectrum. There's nothing better than being able to celebrate, and we all meet at the back door and cheer our patients on as they go home and really celebrate this as a success for them.
Another fact about the staff here, none of the active employees have tested positive for COVID-19. As for Barrett Davis, he says he's walking out of here on May 28th. That's a look inside Wayne's World. I'm Wayne Colville, CBS 6 News.